The attention of the management of Federal Neuropsychiatric Hospital Enugu has recently been drawn to some sponsored, frivolous, falsified, unsubstantiated, misrepresented, and libelous publications in social media about the activities in the hospital, and also personal attacks on the medical director, Dr. Igwe. We want to state categorically that the said publications are mere imaginations without basis and may have arisen out of hallucinatory experiences of the sponsors who are bent on occupying positions they are not qualified for. It actually started sometime in April, following a letter dated 26th April that we got from Nursing and Midwifery Council of Nigeria. I'm going to make available the letter to you people. And that letter suspended regulatory activities of the school on the basis of appointment of new headship without compliance with council regulations for appointment of head of nursing training institutions in Nigeria. There has never been a time in the school was actually shut down by the medical director, as was portrayed in those publications. Hence, they could not have arisen the issue of directives that was said to have emanated from Federal Ministry of Health that the school should be reopened. The school has full accreditation to run and train 50 psychiatric nurses per section, and that runs for 18 months. The school cannot admit beyond a quota, and one keeps wondering where they say 700 students in those publications emanated from. Number 6. The issue of suspension of regulatory activities by the Nursing and Midwifery Council of Nigeria is already being addressed by the management of the hospital, so that our students who are due to write examinations in November 2023 can do so. We are working very hard to sort out all pending issues so that the embargo can be lifted. Resolutions have already been taken in a meeting that involved people from Federal Ministry of Health, Registrar of Nursing and Midwifery Council of Nigeria, and Medical Director of Federal Neuropsychiatric Hospital Enugu, which was aimed at addressing related issues to the suspension of activities by the Nursing and Midwifery Council. A copy of that resolution will be shared to you gentlemen after this, so that you can cite it. The day-to-day running of the hospital follows strict public service rules and financial regulations as set out by the Federal Government of Nigeria and the supervisory agencies. All employments, I must state very loud and clear, in this hospital are monitored by the Federal Ministry of Health, Office of the Head of Service of the Federation, Federal Character Commission, and of course the Board of Management. In fact, all the employments we have done in this hospital, be it interns or regular staff, have always come under strict monitor by these agencies, and we have had certificates of compliance issued to us by the Federal Character Commission. The records are there for anyone that wants to verify. Approvals for leave of absence and study leave in the past 4 years are considered and approved during Board of Management meetings. Every case has always been treated strictly according to public service rules without recourse to sentiments or any bias. The medical director places staff welfare as his main focus of administration. In the past 4 years, there have been cordial working relationship with labor unions as all staff entitlements are properly addressed. Just before this interview, this press conference, I just approved one kind of allowance for our staff with effect from November. The medical director has upgraded more than 200 staff who had additional and verified higher educational qualifications. This is more than all the staff who got such privileges between 1995 and 2019 before the medical director came on board. No sectionalism, no nepotism or favoritism ever involved, as the MD has always carried along labor leaders and the administration department in such activities. All staff that work in his office were not selected by him. He met them on ground, and he has continued to work with the same staff and go on well with them. The medical director, who was recently given a second tenure of office for 4 years, has brought to bear an unprecedented infrastructural development to the hospital. The group from Federal Ministry of Health, who came to appraise his activities for first tenure, gave him very high recommendations that warranted the immediate past Honorable Minister of State for Health to recommend him for a second tenure, which was approved by the President with effect from 1st April 2023. The medical director has also changed the nearly moribund hospital he inherited in terms of orderliness, cleanliness, following of due process, accrediting schools of nursing, residency program for doctors, and of course the molecular lab. He has also sponsored several staff in all departments to conferences and seminars. The hospital has also made significant breakthroughs recently by recording high number of passes in our residency training for doctors who want to specialize in psychiatry, having 100% pass in nursing external examinations, and winning recently an ECOWAS grant of 100 million naira to help us finance our drug rehabilitation program. In the year 2021, the hospital also placed 5th position among all the specialist hospitals in Nigeria when the ICPC came to do the assessment to check if we follow due process, and they also check anti-corruption index. The hospital community psychiatric model being put in place is highly commended as it covers the 15 senatorial zones in Southeast. However, and too bad to mention, over the past 12 years, one particular staff has tried to place the reputation of the hospital in the negative. I call on all staff, friends of the hospital, and the general public, including those of you here, to disregard all the recent negative reports about the hospital. The staff and management, as led by the medical director, are committed to leaving a legacy of giving the best of mental health care to the Southeast and all our neighbors. We cannot be distracted, as we are convinced that God is on our side. And in fact, I want to mention it and emphasize it, there is no crisis in the hospital. On that note, I want to say thank you and God bless.